talk about orthotics today. And the reason we're going to talk about orthotics is because there's a lot of misconceptions about what orthotics really are. True orthotics are put in your shoes. They're usually designed by what kind of doctor? A podiatrist, right? Who is what? What does podiatry mean in common language? What? They're foot doctors, right? So and the reason they give you orthotics is because there's probably something wrong with your what?
Feet.
With your feet, right? They're not trying to fix your ears. They're not trying to fix your eyes. If you lost hearing in your left eye, those orthotics aren't going to help you. So it's for feet, right? And what are some common problems with feet? Say it again. Plantar fasciitis, exactly. You said soreness. Yeah, foot soreness. Yeah, bunions, right? Bunions. Sometimes flat feet can cause problems. How do flat feet cause problems?
The arch.
Yeah. So what's the big deal about having low arches? Yeah. Right. So what's the big deal? Yeah, you're misaligned from the ground up, right? So biomechanically, you're at a disadvantage. It used to be they wouldn't let you in the military if you had flat feet. And but that's not the case anymore because they're like, just run on flat feet. What's the big deal? So one of the things you guys notice when you do the scans, have you noticed we do a side picture? Why do we do that side picture? Posture, right. What part of the posture? Shoulders and what?
Head.
And what about the head?
Forward.
Yeah, so flat feet can cause the head to go forward. Isn't that interesting? When the arches collapse, the head goes forward a little bit. I don't know exactly why, but I do know that there's a connection between your posture and your feet. So the orthotics that chiropractors talk about are not designed specifically. They can help with plantar fasciitis. They can help reduce the growth of bunions. They can help your feet stop hurting by putting them in the right position. But that's not the main purpose of the orthotics that chiropractors recommend. And also, I don't know, has anybody had orthotics from a podiatrist? No? Okay, so typically what happens is they don't have all these bumps and lumps. They're kind of smooth. And they put a little cup in the heel so it's rounded. Because if you have a heel spur or a bone spur and you have a little cup under your heel, it takes pressure off the bone spur at the bottom of your heel, takes the pain off, right? So it makes you more comfortable. You'll stand. Sometimes they pad them to make them softer. Sometimes they don't. But it doesn't have these lumps and bumps. It basically puts your foot in the position it should be in so that when you walk, your foot's in the same position. Now, let me ask you this. I'm going to ask the doctors. Is the foot one big bone with toes in front of it? No. Now, you guys probably knew the answer to that one, too. What's in a foot?
Isn't it like 26 or 7 bones in the foot?
Yeah, there's a lot of bones, and we need to look that up, how many exactly there are. You guys can just Google it at home. But there are a lot of bones, right? You've got your calcaneus, your talus, you've got the cuneiforms, you've got is it cuboid? Cuboid, cuneiform. You've got the metatarsals, the tarsals, the phalanges. There's a lot of bones, right? And I probably missed a few, but they're all in there. Why? Anybody can answer this one. Why does the foot have so many bones? Wouldn't it be easier if the foot was just one bone like this? There was just one bone. Why do we have so many bones?
If all surfaces were level, that would probably work.
Yeah. Does that make sense? So if you step on the ground, do you instantly know if the ground is level, tilted, upward, downward? When you put your foot on it, do you know that as soon as your foot is on the ground?
Yeah. No.
Well, think about it. Do you need to look at the ground, or does your foot talk to your brain? It does talk to your brain, right? So let me change the question. If you step on a rock, and the rock is, let's say, in the middle of your foot like this, will you know you just stepped on a rock? Mm-hmm. You know, right? Just like if you step on a rusty nail, you pretty much know you just stepped on a nail. You don't know if it's rusty, but you know you stepped on a nail, right? So the feet need to tell the brain where the ground is, and which is like if your brain, like you said, has no idea. what's down there until the foot hits the ground, and then it tells you. So what happens when you walk is the heel of the foot hits the ground first, right? Instantly. So the reason there's two bones in the heel, the talus and the calcaneus, is because they need to tilt with respect to each other. And we have these things called mechanoreceptors. You guys know what mechanoreceptors are? You know what a receptor is? What's a receptor? Yeah, it receives a signal and sends it to the brain, right? So there's like chemoreceptors, right? There's thermoreceptors. Chemoreceptors like chemicals, right? Like they sense different chemicals like acidity, base. Thermoreceptors will tell you if it's cold or warm. You know, there's pressure receptors like baroreceptors, tell you if something has pressure or not. Mechanoreceptors tell you how something is lined up. So you have the reason you have all these bones in your foot is because when one tilts a certain way, instantly your brain knows, hey, I must have stepped on something that's tilted this way. And when the calcaneus hits the ground and the ground is slanted this way, or you step on the edge of a curb, have you ever done that? And you roll your ankle, right? Now, if the calcaneus tells the brain instantly, hey, you're about to roll your ankle, the brain sends a signal to the peroneal muscles on the outside of your leg and pulls the ankle back so you don't roll that ankle. That's called coordination. And the more coordinated you are, the less likely it is you'll roll your ankle. But the minute you sprain your ankle, you lose coordination in that ankle. And then you're more susceptible to rolling the same ankle over and over and over. Basketball players will tell you, I always sprain this ankle. Not this one, this one. Over and over and over. Why? Because they never rehabbed it probably and never taught the foot to talk to the brain properly again. So every time they step on someone else's foot on a basketball court, their ankle rolls. When they step on someone's foot with the other one, the brain can sense that and send the muscles to contract it, and you stand up straight. So the reason we use these orthotics is because we want to activate certain mechanoreceptors. Every mechanoreceptor has a reflexive muscle contraction associated to it. So I can push on a part of your foot and a muscle in your spine will contract. Isn't that pretty cool? So because if the ground is slanted, you don't want to stand leaning. You still stand up straight because there's a thing called the rider's reflex that wants to keep your eyes level at all times. So even if like you have scoliosis, your head will come back. So one shoulder might be down, your head will come back, your eyes will stay level because it's called the rider's reflex, R-I-D-E-R, rider's reflex. So everything's connected. That's why there's methods like the Pettibon technique where you hang weights, and if you hang a weight on this side of your head, technically your head should follow that side, right? But it doesn't. That weight makes the muscles on this side contract and bring your head back because your brain wants to keep your eyes level at all times. And so it will automatically strengthen the muscles on that side. And there's ways to reduce scoliosis in the abnormal curves of the spine by hanging weights on the head, which is called the Pettibon technique. It's pretty neat. But we can correct spinal curvature with these. Because you guys see how there's lumps and bumps throughout. This is called the metatarsal arch, the lateral arch, the medial arch, and the heel pad. And the heel pad sometimes has a tilt to it. You'll see in some people's orthotics, if their calcaneus naturally tilts in, like in pronation, they'll put a slant right here so that every time they step, the calcaneus goes up a little bit. And that tells the brain, hey, the ground is like this, and the brain tells the muscles of the spine, then we better hold it this way or that way. And that's why, does all that make sense? Any questions? So can you see why these are different than an orthotics you get from a podiatrist? The purpose is different. These are designed to get rid of back pain. These are designed to level your pelvis, take pressure off your hips, or divide the pressure evenly between both hips so one doesn't wear out. It helps your knees, it helps your hips, it helps your spine, your pelvis. It even helps with headaches. There are people who get headaches because their foot has that dysfunction in it, and when they're walking, it's causing different muscles to contract, and it goes all the way up to the brain, cause tension in the neck, which can refer pain to the head. So these are critical. Now, how many of you have these? You have them? Do you wear them every day?
Yep.
Tell me what your experience has been with them.
Oh, it's life-changing for me.
Okay.
Because I could never find the right pair of sneaker. I would put those inserts in for an arch, and that kind of helped a little bit, but really wasn't quite right. I started wearing these, and I can tell my hip is way better than it has been.
Good.
I mean, I'm having the treatments too, but the hip is
Sure.
completely different. And I can walk all day. We have long shifts.
Yeah.
And my feet do not hurt.
Yeah, you guys are always on your feet, right? Have you experienced the same thing when you stand on them? Oh, sweet. Okay, very cool. Very cool. So anyways, I don't wear any shoes without the orthotics. So what I want to do is I want to have a volunteer. And before you volunteer, let me tell you what I need. I want you to, you're going to stand and do a squat. And I'm going to watch and see how you squat. And I'm going to tell you what the proper squat is. And then you're going to stand on these. Now, these are not custom designed for you. They are just testers. So they're test orthotics. But I want you to stand on a test orthotics and then do a squat and see if it makes a difference. So anybody here have trouble squatting? Like your knees feel weird? Okay, cool. So can you volunteer, please? And then let's have you stand right there, face this way, and I want you to hold your arms up in the air like this. Good. And then squat down slowly as far as you can and hold it for a second. Good. And come back up. All right, and you can put your arms down. So it was hard to go deep.
Mm-hmm.
What did you feel?
Kind of just tight on the front. Felt like I was going to fall.
Oh, interesting. All right. So before I talk about any more, because I'd like to see your thighs go all the way to parallel with the ground. And the other thing we need to see is as she goes down, so I'll go sideways to the camera here. The leg and the torso need to be parallel. So some people will bend forward more, some people will lean this forward more to squat. Those are not good. And then from the front, when you watch a squat, sometimes the knees will rotate this way, or one knee goes in when you squat, or the hips will twist to one side as you squat down. That can be a sign of ankle dysfunction, or it could be hip dysfunction. So what I want to do is I just want to see your feet were about that far apart. Does that look about right? And your toes were rotated just a little bit out. So go ahead and stand on these. Oh, they're perfect size, too. Good. All right. And you feel the lumps and the bumps under your feet, right? We did nothing else. We didn't do an adjustment or anything else. Put your arms up in the air, and let me see if you can squat any differently. Does it feel any different? You can be honest.
Yeah. I mean, I didn't feel like I was going to fall backwards as much.
Good. Good. So step off, do a squat, and step on, do a squat again. And stay right there. Okay, so you guys see how there's a little bit of a, and you lost your balance going backwards again. Very neat. So come back on and do it one more time. Good, and hold that for a second. Come back up. Pretty good. So it's not a tremendous change, but you can see squat is a very compromising position. You really have to be balanced on both feet. Everything needs to work properly. Does anybody else want to give it a shot? Do you want to try it? Sure. All right, give it a shot. So let me see where you normally put your feet and do a squat. Good. Yeah. Arms up, squat down. Come back up. Okay. So your knees go forward. You guys see that? So for you it'd be more like a falling forward type thing. So try it with this. Don't let your heels come off the ground. Just squat down as far as you comfortably can without your heels coming off.
Her toes also went out to the sides as she went down.
That's true. Yeah, I saw that. So let's flare these out just a little bit more. There you go. Try that. Do you feel the lumps under your feet?
Yeah, I do.
All right. Let's see if you can squat any differently.
Yeah, I guess so.
Wow.
I don't know if I'm doing this right, though.
That's okay. That's okay. So you stay a little more upright and your knees come a little forward more. So what I want you to do now is let your hips go back as you go down. Yeah. That's amazing. Come back up. And then do it one more time without the orthotics.
That's pretty good.
And try to do the same thing. Hips back and see if you can do the same kind of squat. That's pretty good right there. Good. Does it feel different with or without the orthotics? So squat again with them and see if you feel any different, any more stable, any without falling.
Oh, am I doing this right? Yeah, maybe.
Yeah, I think your heels still come off the ground.
I want to.
Yeah, and that makes you lose your balance because you come up on your toes.
Yeah.
But on those, you're much more stable. So basically, the only reason is when you press on those areas under the foot, you activate stabilizing muscles around the spine. And it just makes you stand better, squat better, walk better, everything else improves. And people who wear the orthotics hold their adjustments longer. Because can you imagine if she doesn't have those orthotics, every time she has to squat down, she's throwing things out of alignment because muscles are firing in unevenly. And then how would that help when you're in the gym working out or outside jogging? Like, people say don't run too much because you'll get arthritis in your hips. That's one of those common sayings. People run a lot, well, why do they get arthritis in just one hip? Is because there's an imbalance there. But if we distribute the pressure and stress between both feet and the hips, now one doesn't wear out faster than the other. A lot of people go to the doctor says, oh, you have arthritis in your right hip. And they go, why did I get arthritis? Well, you're getting old. And they say, I wonder if the doctor knows this hip is the same age as this hip. Why did this one get old and not this one? It's because you're stressing it more. So anyways, hopefully that helps with orthotics. Does anybody have questions about orthotics? How many of you are now going to go get orthotics? Yeah, very good. Isn't that important? So anyways, when we're talking to our patients as well, we need to be explaining to them this is not designed to, because you should go to literally, if you have foot problems, you should go to the podiatrist. They know the foot better than we do. They can help you better than we. But if you want something that you stand on that makes you stable, stronger, healthier, better, hold your adjustments longer, now you should get the orthotics that we do, which are called foot levelers. So anyways, thanks for watching, thanks for listening, and we'll come back to you with another video soon.